The fluorescent lights in exam room 4 were flickering again. I could hear the hum, that low, persistent electrical buzz that made the silence feel heavier. The boy sat on the edge of the exam table, his legs dangling, his shoulders slumped forward like he was carrying something too heavy to name. His mother stood beside him, her hand resting on his back, her eyes darting between his face and mine. She was searching for something, reassurance maybe, an answer, but I didn't have one yet. The boy's name was Marcus, 15 years old. He looked like he hadn't slept in weeks. His skin was pale, almost gray under the harsh hospital lighting. His eyes were half closed, and when he blinked, it took him a full second to open them again, like his eyelids weighed too much. "He's just tired," his mother said. Her voice was thin, stretched tight. "He's been tired for a while now. I thought maybe it was school stress, or his phone keeping him up, but..." She trailed off. Her hand trembled slightly. I nodded, pulling the stethoscope from around my neck. My fingers felt cold against the metal. I stepped closer, and Marcus didn't move. He didn't even look up. "Marcus," I said gently, "I'm Dr. Reyes. I'm going to check a few things, okay?" He nodded, barely. I pressed the stethoscope to his chest. His heartbeat was there, steady but faint. His breathing was shallow. I moved the stethoscope to his back, listening for anything unusual. Nothing. But something still felt wrong. Then I noticed his hands. They were resting on his knees, and his fingers were trembling. Not a nervous tremor. Something deeper. Something involuntary. I glanced at his mother. "How long has he been like this?" 2 weeks, she said. "Maybe 3. It started small. He'd come home from school and go straight to bed. Then he started sleeping through dinner. Now he can barely get out of bed in the morning." I crouched down so I was at eye level with Marcus. "Hey, buddy, can you tell me how you're feeling?" He blinked slowly. His lips parted, and for a moment I thought he wasn't going to answer. Then he said, "Tired." Just one word. But the way he said it, like it was the only truth he knew, sent a chill down my spine. I stood up, my mind racing. Fatigue in a teenager wasn't uncommon. Late nights, poor diet, dehydration. But this wasn't just fatigue. This was something else. I looked at his mother again. "Has he had any other symptoms? Headaches? Dizziness? Trouble concentrating?" She nodded quickly. "Yes, all of that. And he's been bruising easily. Look." She lifted Marcus's arm, and I saw them. Dark purple bruises scattered across his forearm. Some were fresh, some were fading to yellow. They didn't look like the kind of bruises you get from playing sports or bumping into furniture. They were too many, too random. My chest tightened. "Okay," I said, keeping my voice steady. "I'm going to order some tests, blood work to start. We'll figure this out." But even as I said it, I felt the weight of something unspoken settling in the room. Because fatigue and bruising together, those weren't just symptoms. They were warnings. And what I would discover in the coming hours wasn't just a medical diagnosis. It was a race against time that would test everything I thought I knew about medicine, about compassion, and about what it means to truly fight for someone's life. It was my 3rd month at Hospital St. Halstead, 3rd month as a resident, 3rd month of trying to prove I belonged here. The hospital was a fortress of glass and steel, sitting at the edge of a city I still didn't know by heart. Inside, the halls smelled like disinfectant and stale coffee. The walls were painted in neutral tones, beige, pale blue, white, colors meant to calm, but they only made the place feel colder. Every morning started the same way. I'd arrive at 5:30 a.m. before the sun was fully up, when the parking lot was still mostly empty and the air had that sharp, clean quality that disappears by midday. I'd walk through the sliding glass doors, past the security guard who always nodded but never smiled, and take the elevator to the 4th floor where the resident lounge was located. The lounge was a cramped space with mismatched furniture, a coffee maker that hadn't been properly cleaned in months, and a bulletin board covered in mandatory training notices and shift schedules. It smelled like old pizza and stress. This was where we gathered before rounds, where we reviewed charts, discussed difficult cases, and tried to mentally prepare for whatever the day would throw at us. I worked under Dr. Amelia Cross, an attending physician in internal medicine. She was sharp, efficient, and terrifyingly good at her job. She could diagnose a patient in under 5 minutes and explain their entire medical history without looking at a chart. She had this way of asking questions that seemed casual, but were actually incredibly precise, narrowing down possibilities until the answer became obvious. I wanted to be like her, but mostly, I was just trying not to mess up. "Doctor," Cross was in her mid-40s with short, dark hair streaked with gray that she never bothered to dye. She wore reading glasses on a chain around her neck and had a habit of tapping her pen against her clipboard when she was thinking. She was demanding, occasionally intimidating, but fair. If you worked hard and showed genuine care for your patients, she'd go to bat for you. If you cut corners or showed up unprepared, she'd tear you apart. The other residents called her the Sphinx because she rarely gave direct answers. Instead, she'd pose questions that forced you to think through the problem yourself. It was exhausting, but it was also the best training I could have asked for. That particular morning, the morning Marcus came in, I'd been reviewing a patient with congestive heart failure when my pager went off. It was the ER. New patient, exam room 4. I grabbed the chart from the electronic system, scanned the chief complaint, extreme fatigue, and headed down. The hallway was crowded with nurses, patients in wheelchairs, and the constant beeping of monitors. A man was arguing with a registration clerk about his insurance. A woman was crying quietly in the corner, her face in her hands. A child was screaming, the sound echoing off the hard floors and walls. This was the soundtrack of a hospital. Chaos barely contained. I weaved through the crowd, my white coat swishing against my legs, my stethoscope bouncing against my chest. I'd learned to move quickly through hospital corridors, to navigate the traffic of gurneys and equipment carts, and people who always seemed to be in a hurry. When I opened the door to exam room 4, I saw them. Marcus and his mother. She looked like she hadn't slept much either. Her hair was pulled back in a messy ponytail, and her clothes were wrinkled, jeans and a faded blue sweater with a coffee stain on the sleeve. She'd probably rushed here straight from work, or maybe she'd been up all night worrying. Marcus sat on the exam table, his head bowed, his hands limp in his lap. He was wearing a gray hoodie and basketball shorts, and his feet were bare except for white socks. The room was small, sterile, utilitarian. There was the exam table with its crinkly paper covering, a small sink in the corner, a blood pressure cuff mounted on the wall, and a rolling stool for the doctor. A single window looked out onto the parking lot, where I could see cars arriving, people getting out, carrying bags and flowers and worried expressions. I introduced myself, ran through the basics, asked questions, listened, examined. But the whole time, my mind was circling the same thought. This isn't just fatigue. After I left the room to order the blood work, I found Dr. Cross in the nurse's station. She was standing in front of a computer, typing notes into a patient's chart. She didn't look up when I approached. "Dr. Cross," I said. "Reyes." She kept typing. I just saw a 15-year-old with severe fatigue and spontaneous bruising. That got her attention. She stopped typing and turned to face me. Her eyes were dark, sharp, assessing. "Spontaneous bruising?" "Yeah, multiple sites. No history of trauma. Mother says it's been progressive over 2 to 3 weeks." She nodded slowly. "What else?" "Pale, weak. Looks like he hasn't slept in days. His mother says he's been sleeping 12 to 14 hours a day and still wakes up exhausted. He's been missing school. No energy for activities he used to enjoy. Any fever?" "Not that she mentioned. No night sweats either. No weight loss that she's noticed, though she said his appetite has decreased. Family history?" I didn't get into that yet. I wanted to get the basic lab started first. Dr. Cross crossed her arms, her pen tapping against her elbow. "What are you thinking?" I hesitated. I didn't want to jump to conclusions, but the signs were there, clear as day if you knew what to look for. Possible anemia, maybe a clotting disorder. Could be nutritional deficiency, though that wouldn't explain the bruising pattern. She studied me for a moment, her expression unreadable. Or, I swallowed. The word felt heavy in my mouth. Or something hematologic, bone-marrow issue. She didn't confirm or deny. She just said, "Get me those results as soon as they come back. And do a thorough history. I want to know about any exposures, medications, toxins, chemicals, any recent infections, any family history of blood disorders or autoimmune disease, everything." Then she turned and walked away, leaving me standing there with a knot in my stomach and a growing sense that this case was about to consume my entire day, maybe longer. I went back to exam room 4 with a clipboard and a renewed sense of purpose. I needed to dig deeper. Every detail mattered now. Marcus's mother's name was Diane. She was 39 years old, worked as a medical billing specialist at a private practice across town, single mother. Marcus's father hadn't been in the picture since Marcus was 3. She was articulate, clearly intelligent, and desperately worried. I sat down on the rolling stool and pulled out my pen. "Diane, I need to ask you some more detailed questions. It might seem like a lot, but every piece of information helps. She nodded quickly. Whatever you need. Has Marcus been sick recently? Any colds, flu, infections? He had a cold about a month ago. Nothing serious. It lasted about a week, then went away. Any medications? Prescription or over-the-counter? Just ibuprofen sometimes for headaches. That's it. Does he take any vitamins or supplements? A multivitamin, the gummy kind. He's been taking those for years. Any exposure to chemicals? Does he work anywhere? Help with any projects at home involving paint, solvents, anything like that? She shook her head. No, he's just a student. He doesn't have a job yet. What about at school? Any science labs, art classes? He takes chemistry, but they haven't done any major lab work this year. Just demonstrations. I made notes. Any family history of blood disorders? Anemia? Clotting problems? Cancer? She paused. Her expression shifted, and I saw something flicker in her eyes. Memory, or maybe fear. My mother died of leukemia when I was in college. She was 51. My pen stopped moving. What type? Acute myeloid leukemia. AML, I think they called it. I felt my pulse quicken. That was significant. A direct family connection to hematologic malignancy. Anyone else in the family with blood disorders? Not that I know of. My father is still alive, he's healthy. I have one sister, she's fine. No other issues. I nodded, trying to keep my expression neutral. Okay. And Marcus, has he had any other symptoms you haven't mentioned? Bone pain? Joint pain? Any lumps or swelling anywhere? No lumps, but he did say his legs hurt sometimes. I thought it was growing pains. He's had a growth spurt this year. When did the leg pain start? Maybe a month ago? Around the same time as the cold. I wrote that down. Bone pain, fatigue, bruising, possible familial predisposition. The picture was getting clearer, and I didn't like what I was seeing. I turned to Marcus. He'd been quiet this whole time, his eyes closed, his breathing slow and steady. For a moment, I thought he might have fallen asleep. Marcus, I said gently. His eyes opened slowly. I know you're tired, but I need to ask you a few things. Can you do that for me? He nodded. The pain in your legs, can you describe it? He thought for a moment. It's like deep, inside the bones. It's worse at night. Does anything make it better or worse? Moving around makes it worse. Lying still helps a little. Have you had any nosebleeds? Bleeding gums when you brush your teeth? Yeah, he said. A couple nosebleeds. And my gums bleed sometimes. Another piece of the puzzle. Bleeding tendencies. Low platelet count would explain that. Any dizziness? Shortness of breath? Sometimes when I stand up too fast, I feel dizzy. And I get out of breath walking upstairs now. I used to run those stairs at school, but now I have to stop halfway. I looked at Diane. She was watching me, her hands clasped tightly in her lap. She knew. Maybe not the details, but she knew this was serious. Okay, I said, standing up. The lab should have your blood soon. We're going to run a complete blood count, metabolic panel, and a few other tests. It'll take about an hour to get the results. In the meantime, Marcus, I want you to rest here. Try to relax. And Diane, if you need anything, water, coffee, bathroom, there's a family waiting area just down the hall. Can I stay with him? She asked. Of course. She reached over and took Marcus's hand. He didn't pull away. He just sat there, staring at nothing, his eyes half closed again. I left the room and headed to the lab. I wanted to check on the blood draw myself, make sure everything was being processed correctly. This wasn't a case where I could afford any delays or errors. The phlebotomist, a woman named Rita, who'd been working at St. Halstead for 20 years, was just finishing up with another patient. I caught her attention. Rita, I need you to do a draw on the patient in exam room 4. 15-year-old male, CBC with differential CMP coagulation studies and a peripheral blood smear. Mark it as stat. She nodded. I'll get to it right now. Thanks. And Rita, handle it carefully. I think this kid is really sick. She met my eyes. She'd been around long enough to recognize the tone in my voice. I'll take care of him. The lab results came back an hour later. I was in the break room, nursing a cup of black coffee that tasted like burnt rubber, when my pager buzzed. I pulled it from my pocket and saw the message. Marcus Johnson, CBC results available. I set the coffee down, half finished, barely touched, and headed to the nearest computer. My heart was beating a little faster now, that anticipatory tension that comes when you're about to confirm what you already suspect. I logged in, pulled up Marcus's chart, and clicked on the lab results. The numbers appeared on the screen, and my stomach dropped. White blood cell count, 2,500 cells per microliter. Normal range, 4,500 to 11,000. Hemoglobin, 7.2 GDL. Normal range for a teenage male, 13.5 to 17.5. Platelet count, 40,000 per microliter. Normal range, 150,000 to 400,000. I stared at the screen, reading the numbers again, hoping I'd misread something, but they didn't change. Pancytopenia. All 3 cell lines were down, severely down. This wasn't anemia from iron deficiency. This wasn't a simple nutritional problem. This was bone marrow failure, or malignancy, or something equally devastating. I clicked through to the differential. The breakdown of white blood cells showed decreased neutrophils, the cells that fight bacterial infection. Marcus was immunocompromised, vulnerable. Any infection could become life-threatening. The peripheral blood smear comment caught my eye. No blast cells observed. Recommend hematology consultation. No blast cells was good. That made acute leukemia less likely, but the pancytopenia still needed an explanation. Aplastic anemia, myelodysplastic syndrome, drug toxicity, autoimmune destruction. I printed the results and went to find Dr. Cross. She was in the ICU, consulting on a patient with septic shock. I waited outside the room, watching through the glass as she examined the patient, spoke with the ICU nurses, adjusted medications on the IV pump. She moved with purpose, with confidence. I wondered if I'd ever have that level of certainty. When she finished, she stepped out and saw me holding the printout. She didn't ask. She just extended her hand. I gave her the paper. She scanned the numbers. Her expression didn't change, but I saw the shift in her eyes, the sharpening of focus, the mental gears turning. "Where's the patient?" she asked. "Still in exam room 4. Get him admitted. I want him on a monitored bed. Start him on prophylactic antibiotics, something broad spectrum, and get hematology down here now. Who's on call?" "Dr. Hassan, I think." "Good. Hassan is thorough. He'll want a bone marrow biopsy within 24 hours. She handed the paper back to me. "And Reyes?" I looked at her. "Prepare yourself. This family is about to have their world turned upside down, and you're going to be the one standing there when it happens." Her words settled into my chest like stones. I went back to exam room 4. The walk felt longer this time, heavier. Each step was a countdown to the moment when I'd have to tell Diane and Marcus that their lives were about to change forever. When I opened the door, Diane stood up immediately. Marcus was lying down on the exam table now, his eyes closed, his breathing slow and even. "Do you know what's wrong?" Diane asked. Her voice was tight, controlled, but I could hear the tremor underneath. I closed the door behind me. The click of the latch sounded too loud in the quiet room. "We got the blood test results back. Marcus's blood counts are very low. His white blood cells, red blood cells, and platelets are all significantly below normal range." Her hand went to her mouth. "What does that mean?" "It means his body isn't producing enough blood cells. We need to do more tests to figure out why." I kept my voice calm, steady, professional. "I'm going to admit him to the hospital so we can monitor him closely and run additional tests. One of those tests will be a bone marrow biopsy, which will help us understand what's happening inside his bone marrow. That's where blood cells are made." She was shaking her head slowly, not in denial, but in disbelief. "Is it cancer? Like my mother?" "We don't know yet," I said carefully, "but we're going to find out. The biopsy will give us much more information. There are several conditions that can cause low blood counts, and not all of them are cancer. But whatever it is, we need to identify it so we can start treatment." She turned to look at Marcus. He was still lying down, his eyes still closed. I wasn't sure if he was asleep or just too tired to participate in the conversation. Maybe it was better that way. Maybe he didn't need to hear the fear in his mother's voice. "Okay," she whispered. "Okay. What happens now?" "I'm going to get the admission paperwork started. A nurse will come to take Marcus upstairs to a room on the pediatric floor. We'll keep him comfortable, start some supportive care, and a specialist, a hematologist, will come to see him later today. His name is Dr. Hassan, and he's one of the best we have." She nodded, but her hands were shaking. She clasped them together tightly, trying to stop the trembling. "Can I stay with him?" "Yes, absolutely. You can stay with him the whole time." "Thank you," she said, and her voice broke on the second word. I wanted to say something comforting, something reassuring, but I'd learned in my short time as a resident that false hope was worse than no hope. So I just said, "We're going to take good care of him. I promise you that." The admission process took about 30 minutes. I filled out the electronic forms, wrote the admission orders, prophylactic antibiotics, IV fluids, monitoring protocols, restricted activity, infection precautions, and coordinated with the pediatric floor to get a private room ready. A transporter came with a wheelchair, and Marcus was taken upstairs. Diane walked beside him, carrying a tote bag with snacks, magazines, and a phone charger. The little things you grab when you're leaving your house and you don't know when you'll be back. I followed them up. The pediatric ward was on the 4th floor. The walls were painted in soft yellows and blues, and there were cartoon decals on the doors. Dinosaurs, spaceships, smiling suns. It felt wrong, too cheerful for what was happening, but I suppose that was the point. Kids needed something to look at besides white walls and medical equipment. Marcus's room was at the end of the hall, room 412. It was small but clean, with a window that looked out over the city. You could see the downtown skyline in the distance, buildings clustered together like teeth. The room had a hospital bed, a reclining chair for family members, a small table, and a television mounted on the wall. There was a bathroom attached, and a whiteboard on the wall where the nurses would write their names and the care plan for each shift. Marcus climbed into bed, and a nurse, a young woman named Jennifer with bright red hair and kind eyes, got him settled. She started an IV, took his vital signs, and gave him a hospital gown to change into. "I'll be checking on you every few hours," she said to Marcus. "If you need anything at all, just press this button." She showed him the call button attached to the bed rail. "And try to rest. I know it's hard to sleep in a hospital, but your body needs it." Marcus nodded. He looked smaller somehow, lying in that bed, more vulnerable, less like a teenager, and more like a child. Jennifer turned to me. "Doctor, Hassan is on his way. Should be here within the hour." "Thanks," I said. After she left, I pulled up a chair next to the bed. Diane was sitting in the recliner, her tote bag in her lap, her eyes fixed on Marcus. "How are you feeling?" I asked him. He shrugged. "Tired." Same word, same flat tone. It was his default answer now, the only way he knew how to describe what was happening to him. "I know, but we're going to help you feel better. I promise." He looked at me, really looked at me for the first time since we'd met. "Do you know what's wrong with me?" I wanted to lie. I wanted to tell him it was nothing serious, that he'd be fine, that this was all just a precaution, but I couldn't. "Not yet," I said, "but we're going to find out. And whatever it is, we're going to fight it. You, me, your mom, the whole team here. We're in this together." He held my gaze for a moment longer, then nodded and closed his eyes. Diane looked at me. Her expression was a mixture of gratitude and terror. "Thank you for being honest with him. He deserves that," I said. Dr. Ibrahim Hassan arrived at 7 p.m. He was a tall man with graying hair, dark eyes, and a calm, measured presence. He wore a white coat over dress pants and a button-down shirt, and he carried a leather bag that looked like it had been with him for decades. He was originally from Egypt, had trained at Johns Hopkins, and had been at St. Halstead for 15 years. He was known for being thorough, meticulous, and occasionally intimidating, but he was also known for caring deeply about his patients. He introduced himself to Marcus and Diane, asked permission to examine Marcus, and then spent 20 minutes doing a complete physical exam. He looked at Marcus's skin, felt his lymph nodes, palpated his abdomen, checked his joints, examined his eyes and mouth. He was quiet while he worked, his expression neutral, giving nothing away. When he finished, he pulled up a chair and sat down. "I've reviewed the lab results," Dr. Reyes ordered. "Your blood counts are quite low, Marcus. All 3 types of blood cells, white cells, red cells, and platelets, are below where they should be. This condition is called pancytopenia." Marcus and Diane both nodded, listening intently. "There are several things that can cause this," Dr. Hassan continued. "Some are related to the bone marrow not producing enough cells. Others are related to the body destroying cells too quickly. To figure out which one is affecting you, I need to look at your bone marrow directly. That means doing a bone marrow biopsy." "When?" Diane asked. "Tomorrow morning. We'll schedule it for first thing. You won't be able to eat or drink anything after midnight tonight, Marcus, because we'll give you sedation for the procedure." "Will it hurt?" Marcus asked quietly. Dr. Hassan didn't sugarcoat it. "You'll feel some pressure and discomfort, but the sedation will help. We'll numb the area first, and you'll be given medication to relax you and reduce pain. Most patients say it's uncomfortable but tolerable, and it's quick, usually takes less than 30 minutes. Marcus swallowed hard but nodded. Dr. Hassan turned to Diane. "I know this is frightening, but getting this information is critical. Once I see what's happening in the bone marrow, I'll be able to make a diagnosis and start treatment." Until then, we'll keep Marcus comfortable and safe. He'll get antibiotics to protect him from infection, and we'll monitor him closely." "What are you thinking it might be?" Diane asked. She needed to know. I could see it in her eyes. Dr. Hassan paused, choosing his words carefully. "The most likely possibilities are aplastic anemia, where the bone marrow stops making enough cells, or a pre-leukemic condition called myelodysplastic syndrome. Less likely, but still possible, is acute leukemia, though the absence of blast cells on the blood smear makes that less probable. There are also some autoimmune conditions and infectious causes we need to rule out." Diane's face went pale. "My mother died of leukemia." Dr. Hassan's expression softened. "I saw that in the family history. That's important information. Some blood disorders do have a genetic component, but let's not jump to conclusions. We'll have much more information after the biopsy." He stood up, shook Marcus's hand, then Diane's. "Try to get some rest tonight, both of you. Tomorrow is going to be a long day, but we'll get through it together." After he left, I stayed with them for a few more minutes. The room felt heavy with unspoken fears. Marcus was staring at the ceiling. Diane was staring at Marcus. "Dr. Reyes," Diane said suddenly, "be honest with me. What do you think this is?" I took a breath. Honesty. She'd asked for honesty. "I think it's serious. The pattern of symptoms, the lab values, the family history, it all points to a bone marrow disorder. But Dr. Hassan is right. We need the biopsy to know for sure. And whatever it is, there are treatments. Medicine has come a long way, especially in hematology." She nodded, but tears were sliding down her cheeks now. She wiped them away quickly, trying to stay strong in front of Marcus. "You can cry," I said gently. "It's okay to be scared. This is scary." "I can't," she whispered. "If I start, I won't stop, and he needs me to be strong." I looked at Marcus. His eyes were closed now, his breathing slow. Maybe he was asleep. Maybe he was just pretending, giving his mother privacy to fall apart. "He also needs you to be human," I said. "You don't have to carry this alone." She didn't respond. She just sat there, tears streaming silently down her face, her hand reaching out to hold her son's. I left them like that, in the dim light of room 412, holding on to each other while the world shifted beneath their feet. I didn't go home that night. I should have. My shift had technically ended at 6 p.m. and it was now past 8, but I couldn't leave. Not yet. I went to the resident lounge, grabbed a protein bar from the vending machine, and sat down at one of the computers. I pulled up everything I could find on aplastic anemia, myelodysplastic syndrome, and acute leukemia in adolescents. I read case studies, treatment protocols, survival statistics. The numbers were sobering. Aplastic anemia, if severe, had a 1-year survival rate of only 20% without treatment. With treatment, immunosuppressive therapy or bone marrow transplant, the survival rate jumped to 70–80%. Myelodysplastic syndrome was trickier, often progressing to acute leukemia, with survival rates varying widely depending on the subtype. Acute leukemia in adolescents, if treated aggressively with chemotherapy, had a 5-year survival rate of around 60–70%. These weren't just numbers. They were Marcus's future, his odds, his life reduced to percentages and protocols. I closed the browser and rubbed my eyes. They burned from staring at the screen. My whole body ached with exhaustion, but my mind wouldn't quiet down. I thought about calling my mother. She'd be awake, probably watching television or reading. She'd want to know how my day went, but I couldn't talk about Marcus. Patient confidentiality aside, I didn't have the emotional energy to explain what was happening. How do you tell someone that a kid, a 15-year-old kid who should be worrying about homework and basketball tryouts, might be dying? Instead, I sent her a text. "Long day. I'm okay. Love you." She responded within seconds. "Love you too, mijo. Get some rest." I smiled at that. Mijo, my little boy. I was 27, a doctor, and she still called me that. I leaned back in my chair and closed my eyes, just for a minute, just to rest them. I must have dozed off because the next thing I knew, my pager was buzzing again. I jolted awake, disoriented, my neck stiff from the awkward angle. I checked the pager. It was 11:30 p.m. The message was from the pediatric floor. Patient in 412 requesting to speak with Dr. Reyes. I stood up, stretched, and headed upstairs. When I got to room 412, the lights were dimmed. Diane was asleep in the recliner, her head tilted to the side, a thin hospital blanket draped over her. But Marcus was awake. He was sitting up in bed, looking out the window at the city lights. "Hey," I said softly, not wanting to wake Diane. "You paged me?" He turned to look at me. "Yeah, sorry, I couldn't sleep." "That's okay." Hospital beds aren't exactly comfortable. I pulled a chair close to the bed and sat down. What's on your mind? He was quiet for a moment, his gaze drifting back to the window. Do you think I'm going to die? The question hung in the air between us, direct, unflinching. The kind of question only kids ask because they haven't learned yet that adults prefer comfortable lies. I chose my words carefully. I think you're very sick, but I also think you're getting the best care possible. Dr. Hassan is one of the top hematologists in the country, and we have treatments that work. I'm not going to lie to you. This is serious, but serious doesn't mean hopeless. He nodded slowly, processing. My mom thinks I'm going to die. I can tell. She's scared. Parents get scared when their kids are sick. It doesn't mean she's right. My grandma died of leukemia. I heard my mom talking about it on the phone earlier. She thinks it's the same thing. I hesitated. This was delicate territory. We don't know yet what you have. It might be something completely different. And even if it were similar to what your grandmother had, medicine has advanced a lot in the last 20 years. Treatments are better. Survival rates are better. He looked at me. But it could be cancer. It could be, but it also might not be. That's why we're doing the biopsy, to know for sure. He leaned back against the pillows, his shoulders sagging. I'm tired of being tired. I just want to feel normal again. I know, and we're going to get you there. But it's going to take time, and it's going to be hard. You're going to have to be strong. I don't feel strong. Strength isn't always about how you feel. Sometimes it's just about showing up. And you're here. You're fighting. That's strength. He didn't say anything for a long moment. Then quietly, are you going to be there tomorrow? For the biopsy? If you want me to be, yes, I do. Then I'll be there. He nodded, and some of the tension seemed to leave his body. Thanks, Dr. Reyes. Call me Noah if you want. He smiled a little. Okay, Noah. I stood up. Try to get some sleep. Tomorrow's going to be a big day. Okay. I left the room, and as I walked down the quiet hallway, I realized something. I'd stopped thinking of Marcus as just a patient. He was a person now, a kid with hopes and fears and questions I couldn't fully answer. And that made everything harder, but it also made it matter more. The next morning arrived too quickly. I'd gone home around midnight, slept for 4 fitful hours, and returned to the hospital at 5 a.m. I showered in the resident locker room, changed into fresh scrubs, and grabbed coffee from the cafeteria before heading up to check on Marcus. He was awake when I arrived. Diane was helping him change into a hospital gown. He looked nervous, his movements slow and uncertain. Morning, I said. How are you feeling? Nervous, he admitted. That's normal, but you're going to do great. A nurse came in to check his vitals and review the pre-procedure checklist. Yes, he'd fasted since midnight. No, he hadn't had anything to drink. Yes, he understood what was going to happen. At 7:45 a.m., a transporter arrived with a gurney. Marcus climbed on, and Diane walked beside him as they wheeled him down to the procedure room in the basement. I followed behind, keeping pace but giving them space. The procedure room was cold and brightly lit. There was a specialized table in the center, surrounded by equipment, monitors, sterile trays, sedation supplies. Dr. Hassan was already there, along with an anesthesiologist and 2 nurses. Diane kissed Marcus's forehead. I'll be right outside. I love you. Love you too, Mom, he said, and his voice cracked slightly. She left, and I could see her through the window, pacing in the hallway, her arms wrapped around herself. Dr. Hassan approached Marcus. We're going to take good care of you. You'll feel sleepy in a few minutes, and when you wake up, it'll be done. Okay? Marcus nodded. The anesthesiologist placed a mask over Marcus's face. Just breathe normally. You'll start to feel relaxed. Within seconds, Marcus's eyes fluttered closed. His breathing slowed and deepened. The anesthesiologist checked his vitals and nodded to Dr. Hassan. He's under. Dr. Hassan positioned Marcus on his side, exposing his lower back. He palpated the iliac crest, the hip bone, where the biopsy would be taken. One of the nurses cleaned the area with antiseptic, the sharp smell of iodine filling the room. Dr. Hassan injected local anesthetic, then waited a moment for it to take effect. I stood off to the side, observing. I'd seen bone marrow biopsies before during my training, but they never got easier to watch. The procedure itself was relatively simple, but it felt invasive, almost violent. A hollow needle would be inserted through the bone and into the marrow space, and a sample would be extracted. Dr. Hassan made a small incision in the skin, then took the biopsy needle, a thick, intimidating instrument, and positioned it against the bone. He applied steady pressure, rotating the needle as it penetrated. There was a crunching sound as it broke through the hard cortex of the bone. Marcus's body tensed, even in his sedated state. The nurse monitoring him adjusted his position slightly. Dr. Hassan advanced the needle into the marrow space, then attached a syringe and began aspirating. Dark red marrow blood filled the syringe. He collected multiple samples, placing them into collection tubes labeled with Marcus's information. Then came the core biopsy. He used a slightly different needle, advancing it into the marrow and twisting to capture a solid piece of marrow tissue. When he withdrew the needle, a thin cylinder of tissue, about an inch long, came with it. It looked like a tiny piece of red, spongy bone. "Got it," Dr. Hassan said. He placed the core sample into a preservative solution. "That's all we need." The whole procedure had taken less than 20 minutes. The nurses cleaned and bandaged the site. The anesthesiologist began reversing the sedation. Within minutes, Marcus started to stir. "Marcus," Dr. Hassan said gently, "we're all done. You did great." Marcus's eyes opened slowly. He looked confused, disoriented. "Is it over?" "It's over. You'll have some soreness in your hip for a day or two, but that's normal. We'll give you something for the pain." They moved Marcus back onto the gurney. Diane was allowed back in. She grabbed his hand immediately. "How do you feel, baby?" "Sore," he mumbled, "and tired. You can rest now. Let's get you back to your room." As they wheeled him out, Dr. Hassan pulled me aside. "The samples are going to pathology now. We'll have preliminary results by this afternoon, but the full report will take 24 to 48 hours. "What are you expecting to see?" I asked. He was quiet for a moment. "Honestly, I'm expecting aplastic anemia, the lack of blast cells on the peripheral smear, the pancytopenia, the family history. It all fits. But we need confirmation. And if it is aplastic anemia, then we start treatment immediately. Immunosuppressive therapy, transfusions, supportive care. And we start looking for a bone marrow donor. Because if the immunosuppression doesn't work, transplant is the only curative option." I nodded, absorbing the information. "What are his chances?" "With treatment? Good. 60 to 80% survival rate. Without treatment? Less than 20% at 1 year, so we can't wait. As soon as we have confirmation, we move." The preliminary pathology results came back at 2 p.m. I was in the resident lounge catching up on charting when my pager went off. It was Dr. Hassan. "Meet me in Path Lab." I dropped what I was doing and headed down to the basement. The pathology lab was a quiet, sterile place filled with microscopes and slides and the faint smell of formaldehyde. Dr. Hassan was standing at a workstation, looking through a microscope. Beside him was Dr. Patricia Ung, the head pathologist, a woman in her 50s with sharp features and an even sharper mind. "Reyes," Dr. Hassan said without looking up. "Come here." I walked over. He stepped aside, and I leaned down to look through the microscope. The slide showed a sample of Marcus's bone marrow. I'd studied enough histology to know what healthy marrow looked like, crowded with cells in various stages of development, red cells, white cells, megakaryocytes producing platelets. But Marcus's marrow looked almost empty. There were vast spaces of yellow fat, with only scattered islands of cellular material. It was like looking at a ghost town. "Severe hypocellularity," Dr. Ung said. "Less than 10% of the marrow space is cellular. No evidence of dysplasia, no blast cells, no infiltrative process. This is classic severe aplastic anemia." I straightened up, my chest tight. It was what we'd expected, but seeing it confirmed was still a gut punch. "What caused it?" I asked. Dr. Hassan shook his head. "We may never know. It could be autoimmune, his body attacking his own bone marrow. Could be a prior viral infection triggering an immune response. Could be idiopathic, which just means we have no idea. We'll run some additional tests to look for specific antibodies and viral markers, but often we don't find a clear cause. So what's the treatment plan? We start him on immunosuppressive therapy, anti-thymocyte globulin, cyclosporine. We'll also give him growth factors to stimulate any remaining marrow function. He'll need frequent blood and platelet transfusions to keep him stable. And we need to search for a bone marrow donor immediately. What about family members? He's an only child, so no siblings to test. We'll check his mother, but parent matches are less likely to be compatible. We'll need to search the national registry. Dr. Ung handed Dr. Hassan a printed report. "The full pathology report will be ready tomorrow, but this is enough to start treatment." Dr. Hassan took the report and turned to me. "Come on, let's go talk to the family." We walked back upstairs together. My stomach was churning. This was the part of medicine they don't really prepare you for in medical school, The conversations where you have to tell someone their life is about to change forever. When we reached room 412, Dr. Hassan knocked softly and entered. Marcus was in bed, awake, looking slightly more alert than he had that morning. Diane was sitting beside him, holding a cup of coffee that had long since gone cold. "Marcus, Diane," Dr. Hassan said, pulling up chairs for both of us. "We have the results from the bone marrow biopsy." Diane set down her coffee cup. Her hands were trembling. "What is it?" Dr. Hassan met her eyes. "Marcus has a condition called severe aplastic anemia. It means his bone marrow, the part of his body that makes blood cells, has stopped functioning properly. It's not making enough white blood cells, red blood cells, or platelets." "Is it cancer?" she asked, her voice barely above a whisper. "No, it's not cancer. It's a different kind of bone marrow disorder, but it is serious, and it requires aggressive treatment." She closed her eyes, relief and fear washing over her face simultaneously. "What kind of treatment?" "We're going to start with medications that suppress the immune system. The theory is that Marcus's immune system is attacking his bone marrow, and if we can calm that response down, his marrow might start working again. We'll also give him blood transfusions when his counts get too low, and medications to stimulate cell production." "Will that cure him?" Marcus asked. His voice was small, uncertain. "It might," Dr. Hassan said honestly. "About half of patients with severe aplastic anemia respond well to immunosuppressive therapy and go into remission. For the other half, we need to consider a bone marrow transplant." "A transplant," Diane repeated. "That means finding a donor?" "Yes. The best donors are siblings, but since Marcus doesn't have any, we'll search the National Bone Marrow Registry. We'll also test you to see if you're a match, though parent matches are less common." "And if you can't find a match?" Dr. Hassan paused. "Let's not get ahead of ourselves. We're going to start the immunosuppressive therapy right away, and we're going to search for a donor. We'll take this one step at a time." Diane nodded, but tears were streaming down her face now. "I don't understand. Why is this happening? What did we do wrong?" "You didn't do anything wrong," Dr. Hassan said gently. "Sometimes these things just happen. The body's immune system malfunctions. It's not your fault, and it's not Marcus's fault." She wiped her eyes, trying to compose herself. "When do you start treatment?" "Today, within the next few hours. We'll move Marcus to a more isolated room to protect him from infections, and we'll begin the first round of therapy. I'm not going to lie to you. It's going to be rough. The medications have significant side effects, but it's our best shot." Marcus looked at me. "Will you still be here? Checking on me?" "Every day," I promised. "I'm not going anywhere." He nodded, and I saw something in his eyes I hadn't seen before. Trust. He was trusting me to help him through this, and I silently vowed not to let him down. The immunosuppressive therapy started that evening. Marcus was moved to a special isolation room on the oncology floor, a room with HEPA filtration, positive pressure, and strict infection control protocols. Anyone entering had to wear a mask, gown, and gloves. Visitors were limited. Everything that came into the room had to be disinfected. It felt like putting him in a bubble, cutting him off from the world to save his life. The first medication was antithymocyte globulin, or ATG. It was derived from horse serum and contained antibodies that would target and destroy his T cells, the part of the immune system believed to be attacking his marrow. It was powerful. It was also brutal. The infusion started at 6 p.m. Marcus sat propped up in bed, an IV line running into his arm, the clear bag of medication hanging from a pole beside him. He looked small in the big hospital bed, dwarfed by all the equipment surrounding him. Diane sat beside him, holding his hand. She'd been tested that afternoon to see if she was a potential bone marrow match. Now they were waiting for those results too. I stood in the corner, monitoring, watching for any signs of a reaction. ATG could cause severe allergic responses: fever, chills, hypotension, anaphylaxis. For the first hour, Marcus tolerated it well. He watched TV, dozed off and on, ate a little bit of the dinner that was brought up from the cafeteria. Then, around 7:30 p.m., his temperature started to rise. The nurse checked the monitor. "He's at 100.8. That's expected. I'll give him some acetaminophen." By 8 p.m., he was at 101.5. By 8:30, he was shaking with chills, his teeth chattering, his whole body trembling. "I'm cold," he said, his voice shaking. "Why am I so cold?" We piled blankets on him. The nurse brought a warming blanket from the warmer, but he kept shaking. His blood pressure dropped, 110/70, then 100/65, then 90/60. "Dr. Reyes," the nurse said, her voice tight. He's getting hypotensive. I moved quickly. Stop the infusion, give him a 500cc bolus of normal saline, and page Dr. Hassan. The nurse stopped the ATG drip and started pushing fluids. I listened to Marcus's heart and lungs. His heart rate was elevated, 120 beats per minute, but his lungs sounded clear. Marcus, I said, leaning close, you're having a reaction to the medication. We've stopped it, and we're giving you fluids. You're going to be okay. He nodded, but his eyes were wide with fear. Diane was standing now, her hand over her mouth, watching helplessly as her son shook and shivered. Dr. Hassan arrived within minutes. He assessed Marcus, reviewed the vitals, and made the call. He's having a cytokine release syndrome. It's a known side effect. We'll slow down the infusion rate, give him steroids and antihistamines to blunt the reaction, and restart at a lower dose. Over the next hour, Marcus's symptoms gradually improved. His temperature came down. His blood pressure stabilized. The shaking stopped, but he looked exhausted, wrung out. That was awful, he whispered. I know, I said, but your body is fighting. That's what this is. Your immune system is reacting to the medication, which means it's working. It doesn't feel like it's working. It feels like I'm dying. I didn't have a good response to that, because in a way, he was right. This treatment felt like poison, but sometimes poison is the cure. Over the next 2 weeks, Marcus underwent daily ATG infusions. Each one was a battle. He'd spike fevers, shake with chills, sometimes vomit from the nausea. But slowly, incrementally, he tolerated it better. His body was adjusting. In the meantime, the search for a bone marrow donor was underway. Diane had been tested and, as expected, was not a perfect match. She was a half match, which could be used in some situations, but a full match would be much better. The National Registry search yielded several potential matches. 5 people across the country who had compatible tissue types. The registry coordinators reached out to them, explained the situation, and asked if they'd be willing to donate. 3 said yes immediately. 2 needed time to think about it. Marcus's case was also listed on several bone marrow donor recruitment websites. His story was shared, anonymously to protect his privacy, in hopes of finding additional matches or encouraging people to join the registry. Every day I'd check for updates. Every day we waited. Meanwhile, Marcus needed regular blood transfusions to keep his counts from dropping too low. Every few days he'd get a unit of red blood cells to boost his hemoglobin. Every week he'd get a platelet transfusion to prevent bleeding. He hated the transfusions. Hated the feeling of cold blood flowing into his veins. Hated the way it made him feel heavy and sluggish. But he endured it because he had to. Diane never left his side. She slept in the chair beside his bed every night. She read to him, played games with him, helped him with the schoolwork his teachers sent over so he wouldn't fall behind. She was his rock, his constant, his anchor in the storm. And I visited every day, sometimes twice a day. I'd check his labs, adjust his medications, talk with the nurses, and then I'd sit with him for a few minutes. We'd talk about basketball, about movies, about the future. When I get out of here, he said one afternoon, I want to go to a real basketball game. Courtside seats. I want to feel the energy of the crowd. You will, I said, as soon as you're strong enough. Do you think I'll be strong enough? I know you will. He wanted to believe me. I could see it in his eyes, but doubt lingered there too, shadowy and persistent. 3 weeks into treatment, Marcus spiked a fever again. But this time, it wasn't from the ATG. It was from an infection. I was in the ER when I got the call. Marcus Johnson, room 518, fever of 102.5, patient hypotensive, altered mental status. My heart stopped. I dropped everything and ran. When I got to his room, the scene was chaos. Nurses were swarming, taking vitals, starting fluids, drawing blood cultures. Marcus was lying in bed, his face flushed, his breathing rapid and shallow. His eyes were open, but he wasn't tracking. He looked confused, disoriented. Diane was pressed against the wall, her hands over her mouth, tears streaming down her face. What happened? I asked the charge nurse. Fever started about an hour ago. Spiked fast. He became hypotensive and started acting confused about 20 minutes ago. We've started fluids and called Dr. Hassan. I moved to Marcus's bedside. Marcus, can you hear me? His eyes shifted toward me, but he didn't respond. His lips moved, but no sound came out. Sepsis. He had an infection, and it was overwhelming his already compromised immune system. Start broad-spectrum antibiotics, I ordered. vancomycin and cefepime, and get blood cultures, urine culture, chest x-ray. I want to know where this infection is coming from. The nurses moved quickly, executing the orders. I listened to Marcus's lungs, crackles, fluid in the bases, possible pneumonia. His blood pressure was 85/50, even with fluids running wide open. His heart rate was 130. His oxygen saturation was dropping, 92%, then 90%, then 88%. Get him on oxygen, I said. Nasal cannula, 4 liters. A nurse placed the cannula in his nose. His saturation ticked up slightly to 91%. Dr. Hassan arrived, assessed the situation, and made the decision. Transfer him to ICU. He needs closer monitoring. And start pressors if his blood pressure doesn't come up. Within 30 minutes, Marcus was moved to the ICU. It was a different world up there. Louder, brighter, more machines, more beeping, more urgency. Diane followed, clutching her tote bag, her face pale and drawn. I stayed with them. I should have gone back to the ER, but I couldn't leave. Not now. Marcus was intubated later that evening, when his oxygen levels continued to drop despite the supplemental oxygen. The intubation was quick, mechanical, necessary. A tube down his throat, connected to a ventilator that would breathe for him. Diane sobbed when she saw it. He looked so small. He did. Lying there with tubes and wires running from his body, the ventilator hissing and clicking in rhythm, he looked fragile, breakable. He's strong, I said, though I wasn't sure I believed it anymore. He's going to fight through this. But inside, I was terrified. The next 48 hours were the longest of my life. Marcus remained in the ICU, sedated, on the ventilator. His blood cultures came back positive for a bacterial infection, Pseudomonas aeruginosa, a nasty aggressive bacteria that was resistant to many antibiotics. We switched his antibiotics to ones that would target it specifically. His blood pressure remained low despite fluids and medications. His kidneys started to fail, his creatinine rising, his urine output dropping, his liver enzymes went up, his body was shutting down. Dr. Hassan brought in a team of specialists, infectious disease, critical care, nephrology, everyone working together trying to save him. Diane stayed by his bedside, holding his hand, talking to him even though he couldn't hear her. "Please, baby," she whispered. "Please fight. I need you. I can't lose you." I stood outside the ICU room, watching through the glass, feeling utterly helpless. All my training, all my knowledge, and I couldn't do anything to change this. I couldn't make his body respond to the antibiotics. I couldn't make his immune system work. I could only wait. On the second night, Dr. Cross found me sitting in the ICU waiting room at 2 a.m. I hadn't slept, hadn't eaten. I just sat there staring at the floor, my mind numb. "Reyes," she said, sitting down beside me, "you need to go home." "I can't. You're not helping him by running yourself into the ground." "I'm not helping him at all," I said, my voice cracking. "I can't do anything. I'm just useless." She was quiet for a moment. Then she said, "You're not useless. You're here. You're showing up. You're caring. That matters. Does it? Because he's dying, and I can't stop it. Maybe he is, but maybe he isn't. We don't know yet. And until we do, we keep fighting. That's the job." I looked at her. Her face was tired, lined with years of these moments. Years of watching patients fight for their lives. Years of wins and losses. "How do you do it?" I asked. "How do you keep going when you lose someone? You grieve, you learn, and you remember why you started. Because for every patient you lose, there are 10 you save, and those 10 matter just as much as the one." I nodded, though it didn't make me feel better. She stood up. "Come on, I'm taking you to get food. You need to eat something, even if it's terrible cafeteria food." I followed her, and we sat in the empty cafeteria, eating sandwiches that tasted like cardboard, not saying much, just existing in the shared weight of it all. On the third day, something changed. Marcus's fever broke. His blood pressure started to come up. His kidney function began to improve. The antibiotics were working. Dr. Hassan reduced the sedation, and Marcus started to wake up. He was still on the ventilator, but his eyes opened, and he looked around, confused and scared. Diane leaned close. "It's okay, baby. You're in the hospital. You had an infection, but you're getting better. We're right here." He couldn't talk with the tube in his throat, but he squeezed her hand. That squeeze was everything. 2 days later, they extubated him. The tube came out, and he coughed and gasped, and finally took a real breath on his own. "Welcome back," I said, smiling for the first time in days. He tried to smile back, but he was too weak. "That sucked," he rasped, his voice hoarse from the tube. Yeah, I agreed. It really did. But you made it. Barely. Barely still counts. While Marcus was recovering from the infection, we got word from the National Registry. One of the potential donors, a 27-year-old man from Oregon, had confirmed he was willing and able to donate. He'd been through the additional testing, and everything looked good. He was a perfect match, Doctor. Hassan delivered the news to Marcus and Diane on a bright afternoon in late November. The sun was streaming through the window, casting golden light across the room. We have a donor, Dr. Hassan said. A full match. He's healthy, willing, and ready to proceed. Diane burst into tears. Marcus smiled, really smiled, for the first time in weeks. When? Diane asked. We'll need about 3 weeks to coordinate everything. Marcus needs to finish recovering from the infection and regain some strength. Then we'll do preparatory chemotherapy to wipe out his remaining bone marrow and make room for the new cells. The transplant itself will happen after that. 3 weeks, Marcus repeated. I can do 3 weeks. Dr. Hassan looked at him seriously. It's going to be hard, Marcus. Probably the hardest thing you've ever done. The chemo will make you very sick. You'll lose your hair. You'll feel awful. But if you can get through it, you'll have a real chance at a cure. I can do it, Marcus said, his voice stronger now. I want to do it. The next 3 weeks were a blur of preparation. Marcus underwent more testing, heart function, lung function, kidney function, to make sure his body could handle the transplant. He worked with a physical therapist to build up what little strength he had. He met with a psychologist to prepare mentally for what was coming. And he continued the immunosuppressive therapy, the transfusions, the daily blood draws. I visited him every day. We'd talk, play card games, watch movies on the small TV in his room. Sometimes we'd just sit in silence, the weight of what was coming hanging between us. One afternoon he asked me, "Are you scared?" Scared of what? That the transplant won't work. That I'll go through all of this and it won't matter. I thought about lying, about reassuring him that everything would be fine, but he deserved honesty. Yeah, I said, I'm scared, but I'm also hopeful. Because this is your best shot, and I believe in you. He nodded slowly. I'm scared too, but I'm also ready. I'm tired of feeling like this. I want my life back. You'll get it back, I promised. It won't be easy, but you will. The preparatory chemotherapy started 1 week before the scheduled transplant date. It was called conditioning, a misleading term for what was essentially poisoning Marcus's body to destroy whatever marrow he had left. The drugs were harsh. Busulfan, cyclophosphamide. They made him violently ill. He vomited constantly. His hair fell out in clumps. His skin broke out in painful sores. He lost 15 pounds in a week, but he never gave up. Diane stayed with him through every moment. She held the basin when he vomited. She helped him to the bathroom when he was too weak to walk alone. She read to him when he couldn't sleep. And I was there too, adjusting medications, managing side effects, doing everything I could to keep him comfortable. On the night before the transplant, I stayed late. Marcus was awake, staring at the ceiling. Big day tomorrow, I said. Yeah. How are you feeling? Terrified, but also ready. That's normal. This is a big deal, but you've made it this far. You've survived things most people couldn't imagine. You're going to make it through this too. He looked at me. Do you really believe that? Or are you just saying it? I really believe it. He nodded, and I saw tears in his eyes. Thank you for everything, for being here, for caring. My throat tightened. Of course, you're not just a patient, Marcus. You matter, and I'm going to be here every step of the way. He wiped his eyes. I'm glad it's you. I'm glad you're my doctor. I smiled. Me too. The transplant took place on a cold Thursday morning in late November. It wasn't a surgical procedure. No operating room, no scalpel. It was just an infusion, similar to a blood transfusion. The donor's bone marrow cells had been collected the day before, flown across the country and processed in the lab. Now they were in a bag, a small bag of reddish-pink liquid that held Marcus's future. The room was quiet. Diane sat beside Marcus, holding his hand. Dr. Hassan stood by the IV pole, monitoring everything. I stood in the corner, watching, hoping, praying to a God I wasn't sure I believed in. The infusion started at 10 a.m. The cells dripped slowly into Marcus's bloodstream, one drop at a time. It looked so simple, so anticlimactic, but it was everything. Marcus watched the bag, his eyes fixed on it. That's it? That's what's going to save me? That's it, Dr. Hassan said. Those cells will travel to your bone marrow, and if everything goes well, They'll start making new blood cells. Your blood cells. They'll become part of you. Someone I don't even know, Marcus said quietly. Someone gave me this. Yes, a stranger who wanted to help, who wanted to give you a chance. Marcus's eyes filled with tears. I want to thank them. Someday, when I'm better, you will, Dr. Hassan said. The registry allows contact after a year if both parties agree. You'll have that chance. The infusion took 45 minutes. When it was done, Dr. Hassan disconnected the line and smiled. There, it's in. Now we wait. How long? Diane asked. 2 to 4 weeks for the cells to engraft. During that time, Marcus will be extremely vulnerable to infection. His immune system is essentially non-existent, so we keep him isolated, keep him safe, and wait for the cells to take hold. Marcus leaned back against his pillows, exhausted. So now I just wait? Now you wait, and you rest, and you heal. The first week after the transplant was brutal. Marcus's blood counts dropped to nearly 0. He had no immune system, no ability to fight infection. A single germ could kill him. He remained in strict isolation. Everyone who entered had to scrub, gown, mask. No flowers were allowed. They could carry mold spores. No fresh fruits or vegetables. Potential bacteria. Everything was sterilized. Marcus felt awful. The chemo was still wreaking havoc on his body. He had painful mouth sores that made eating impossible. He could barely drink water. He was fed through an IV. But every day I checked his blood counts. White blood cells, red blood cells, platelets, and every day they were still at 0. Day 5, 0. Day 7, 0. Day 10, still 0. Diane was starting to panic. Why isn't it working? Shouldn't we see something by now? Dr. Hassan remained calm. It's still early. Some patients engraft at 2 weeks, some at 4. We just have to be patient. But I could see the worry in his eyes too. On day 12, I checked Marcus's labs in the morning. White blood cell count, 200. Still dangerously low, but not 0. I checked again that afternoon. White blood cell count, 300. The next morning, 500. The cells were engrafting. The donor's marrow was taking hold. On day 16, Marcus's white count hit 1,200, then 1,800, then 2,500. His immune system was coming back. His hemoglobin started to rise. His platelet count started to climb. His body was being reborn. 4 weeks after the transplant, Marcus was discharged from the hospital. He was still weak, still pale, still recovering, but he was alive, and his blood counts were climbing every day. I walked him and Diane to the hospital entrance. It was a clear, sunny day, the kind that made everything feel possible. The air was crisp, clean, and Marcus took a deep breath, his first breath of outside air in over 2 months. It smells good, he said, smiling. Diane wrapped her arm around him. You're coming home, baby. He turned to me. Thank you, Dr. Reyes, for everything, for not giving up on me. I felt my throat tighten. I never would have. You fought too hard to give up on. He hugged me. It was quick, awkward, but real. And in that moment, I felt the weight of the past months lift slightly. They walked out into the sunlight, and I watched them go. A mother and son who'd survived something unimaginable. And I realized something. This was why I became a doctor. Not for the successes, though they mattered, but for moments like this. For watching someone walk out of the hospital when weeks ago, it seemed impossible. 6 months later, I got a letter. It was from Marcus. He was back in school. He'd joined the junior varsity basketball team. His hair had grown back, curly and thick. He was thriving. He wrote, Dear Dr. Noah, I wanted to write to tell you how I'm doing. It's been 6 months since the transplant, and I feel like myself again. Actually, I feel better than myself. I feel like someone who survived something impossible. I'm back in school, and I'm actually enjoying it. I'm playing basketball again. Not varsity yet, but I will be next year. My coach says I have a real shot at a scholarship if I keep working hard. My mom is doing great too. She laughs now, which she didn't do much before. We both feel like we've been given a second chance. I met my donor last month. The registry connected us after the 1-year waiting period. His name is David. He's 27, lives in Oregon, works as a software engineer. He seems really cool. We're planning to meet in person next summer. I thanked him for saving my life, and he said he was just glad he could help. But it's more than that. He gave me everything. And so did you. You believed in me when I wasn't sure I could keep going. You showed up every day, even when things looked hopeless. You cared. I used to think being tired was just part of who I was. But now I know it was my body trying to tell me something. And you listened. You heard what I couldn't say. Thank you for that. Thank you for seeing me, for fighting for me. I'm going to be a doctor someday. Maybe not a hematologist like Dr. Hassan, but something. Because I want to help people the way you helped me. You showed me what it means to be a healer, and I'll never forget that. With gratitude, Marcus, I kept that letter in my locker. I read it whenever I felt overwhelmed, whenever I doubted myself, whenever I wondered if I was making a difference. Because Marcus reminded me why I became a doctor. Not to be perfect, not to have all the answers, but to be there, to listen, to care, to fight for someone when they can't fight for themselves. And sometimes that's enough. Sometimes that's everything. Medicine is not just about diagnosing disease. It's about seeing the person behind the symptoms. It's about hearing what isn't being said. And it's about holding on to hope, even when the numbers don't add up. Marcus taught me that. He taught me that fatigue isn't always just fatigue, that bruises aren't always just bruises, that a tired teenage boy might be fighting a battle no one can see. And he taught me that even when the body fails, the human spirit endures. That's the miracle, not the medicine, the people, the resilience, the will to survive against all odds, and the strangers who become heroes by giving the ultimate gift, a second chance at life. This is what it means to be a doctor, to witness these transformations, to be part of someone's journey from darkness to light, and I wouldn't trade it for anything.